Good evening. Good evening, everyone. It is June 7th, 2021. Um, and I am Theresa White, CEO and founder of End Time Creative Counseling Services. I am a licensed mental health counselor, a registered drama therapist, and I am a certified trauma specialist. Tonight, we do, or Monday nights is when we do our weekly discussion over mental and social topics entitled Drama is Life. So tonight's topic, it is June, and June is PTSD Awareness Month. So feel free to stay and join for these next few moments. We usually talk for about 25 minutes regarding, well, that's the goal tonight. We're going to talk for 25 minutes regarding trauma. Is it really trauma? So, hopefully, by the end of tonight's live, you will have a better idea of what trauma is and what it is not. And so I want to give a disclaimer. Any information that I give tonight is strictly for information and resources only. It is not to replace a therapy session. This is not in any way to diagnose anyone with trauma or PTSD. But I do want to give some information to help people navigate because that word has been coming up a lot lately, right? You hear trauma this, trauma that, and mental health because it's Mental Health Awareness Month. I definitely want to bring space and safety to this live. So if you have questions, feel free to ask them. If you don't feel comfortable asking them in the comment box, feel free to send me a personal message and ask your questions. No one sees those but me, so you can send them on our End Time Creative Counseling page, and we'll get back to you as soon as we see those. Generally, we try to get back to you within 24 to 48 hours. If we miss you, please send us another message. We don't want to miss anyone's questions. We want to definitely be responsive to what you are having concerns about. If you feel comfortable answering and responding, please do. I love interaction, so let me know that you're here. Say hello to me. Feel free to share the video. Feel free to share this information with anyone that you feel like would benefit from what we are talking about and sharing on tonight. And then also feel free to share my information. We are located here in Terre Haute, Indiana, but we do offer in person therapy and also telehealth services. Excuse me. We offer family, individual, and group counseling. And because I'm a drama therapist, my niche and my specialization is drama therapy. What is drama therapy? Although that's not tonight's live, I will give you a snippet of what drama therapy is or is. I won't tell you what it's not, but what it is. It is an embodied technique. It's definitely body based. So we do movement to be able to help address any behavioral or mental concerns that you or goals that you may want to reach in life. No, you do not have to have a mental health diagnosis or any such like to be able to benefit from drama therapy. From youth to adults, male to female, we offer our services to any age, any generation. Our services in particular start at our pre-adolescents. We start with our 10, 11-year-olds, and we are up to adults. So feel free to reach out if you have any questions or you're interested in our services or if wanting to find out how drama therapy can help you. At the end of the video, feel free to stay. I will talk about how drama therapy can help if trauma is something that you or someone you are, one of your loved ones are experiencing. So as you come in, again, feel free to say hello. Let me know that you are here, ask questions, comments, etc. So tonight we are going to be talking about trauma, what it is. So is it really trauma? So to answer that question, so I do want to address the fact. Again, as we've been talking about mental health awareness, May was Mental Health Awareness Month, so we talked about emotions, we talked about different things, and sometimes what we talk about, not intentionally, can be triggering. So when we talk about triggers, I just mean something that shows up that may make someone feel uncomfortable or bother them. So if there is something that we talk about that triggers something in your mind or triggers an emotional response, that is not our intention, but feel free to reach out or take a pause and come back to our video. So if you need to leave the live and come back and watch it afterward, feel free to do that as well. We want to make sure that everybody is emotionally safe, and we're not trying to get anyone, again, in that space yet. But we do want to talk about what it is and what to look for when we're talking about is this actually trauma. So let me give you the clinical definition, or one of the clinical definitions of trauma. So trauma, excuse me, is a powerful emotional response to a distressing event that you have either witnessed, have heard about, or have experienced directly or indirectly. Let me say that again. It's a powerful emotional response to a distressing event that you have been a witness to, involved in directly or indirectly. So with that, I want you to keep that in mind as we talk about some of the responses that we have had, or some of the, what's the word I'm looking for? The topic that we talk about tonight. So trauma is a distressing event. Now, we'll say when we talk about what trauma is, and so since it's PTSD Awareness Month, what PTSD is post-traumatic stress disorder. And so generally when we have talked about PTSD or heard about PTSD, it was directly related to war, being in combat, so you didn't really hear about PTSD anywhere else or regarding anyone else. But as people begin to get more information and education around PTSD, then they begin to say, wait a minute, I've had those experiences, or I've had those symptoms or these reactions, and I didn't go to war. Is this trauma? Is this traumatic for me? Do I have PTSD? So in order to have PTSD, of course, the foundation of the word or the diagnosis is post-trauma. So post-trauma means that there has been at post, of course, the definition of post is this is after a traumatic event or experience. So I'm going to give you a few symptoms. We won't go deep into what trauma is or symptom wise, but I want to just give a few different ones, especially the main one that people may see show up in their lives, and that are, kind of having a question about. So drink some water, y'all. Sorry. Excuse me. One of the main symptoms that I see of trauma, this doesn't mean that you have trauma, but this is a red flag, or what we call a risk factor. If there has been this startle response, so you see the startle response or exaggerated startle response, and everyone, let me pause. Everyone experiences trauma differently, and it's all unique. So that's why it's important for you to hear the information and then apply it to you or someone in your loved one, so they can kind of apply it to their own situation. Because this is not a blanket statement for everybody at one time, but to give you some information to be able to apply and look at situations in your life in the past or currently to be able to answer, is this really trauma? Am I responding to trauma? And so I want you to think about, again, this last year has been stressful. If you talk about a distressing event. And so everyone in the world has been through or is going through this pandemic. And so with this pandemic, I want you to consider in your mind if how you're responding now, or if things are different, if this is trauma. Okay, so that's particularly what we're going to be talking about, COVID in general, or particularly, but you can apply these to other things as well. So one of the symptoms is an increase in irritability, anger, or other negative emotions. And I don't like the term negative, as you guys we've talked about in our past lives. There is no negative emotion. So when you hear the word negative, in a clinical way or with regards to psychology, negative does not mean bad. It does not mean that something is wrong with the emotion. Negative means sometimes the absence of something. So when you think about a test result that you may have got and they come back and say your test results was negative. Okay, so that means that what I was looking for, that particular um, issue or cell or virus, etc., is not present. So sometimes when we talk about irritability, anger, and we talk about emotions being negative, sometimes you can feel like there's a void of emotion. So when we hear negative emotion, that's what I want you to think about. We're not talking about negative in a bad way, but irritability, anger, or this void of not feeling like you have emotions or feeling very empty or blank. So we will call that negative, they're not present. So if that has shown up, as we talked about the response, if that has shown up directly related to the response of a distressing event, then it possibly could be related to that, or it could be trauma if it's related to that event and it's causing problems in your everyday life. And so, with regards to trauma, I also want to give you a second definition really quick. Trauma is a pervasive problem. So when people say like PTSD, or we say stress, so post-traumatic stress, right? Traumatic stress is very different from stress of a life event or stress because changes are happening in life. We all can experience stress, and we all do experience stress. But trauma stress, again, is that distressing, very strong, very powerful. Okay, so it's a pervasive problem. And pervasive means that it's a consistent problem and it's causing issues in other areas in your life, even after the situation has shown up. So it results from exposure, as I said before, to an incident or a series of events that are emotionally disturbing or sometimes life threatening. The pandemic or COVID has been life threatening to some people. Good evening, BJ. So there has been some stress. And even though the vaccine is out and things are not necessarily going back to normal as we would consider back to normal, things are moving closer to that regard. There still may be some emotional responses or mental struggles that people may be having afterward. So irritability, anger, and you also may have an exaggerated response. So that is typically when people say, when you think about the old definition of PTSD or the previous information that comes from PTSD, and we talk about it being related to war and people who have come back from combat, that startled response is kind of where you feel like people are jumpy. Like when you're like, Theresa, what's going on with you? Why are you so jumpy? Like, I just wasn't, and you're just like, you feel like you are jumpy at things that you're extra jumpy, that your body gives an extra startle response, whether that is, physically jump, where someone, and I will say, when you say exaggerated, that means it's hard to come down from that. You don't just jump and then say, oh, okay, it was just a spider. Okay, phew, and move on about your day. You can see that spider or have that response to something, and it's really hard to bring your body back to a calm state. That's what we would call exaggerated startle, where, it was just my mom walking in the door, but that really, as we say, triggered me or caused this response, such a strong response that I'm having a hard time calming down. One of the other symptoms that we talk about with regards to trauma is avoiding things, avoidance of reminders. That is a huge one. And so with regards to what people have been through lately, and I've heard people say over and over again, like, throw the whole year away. Like, it has just done some really trippy things to people's lives. People have lost family members and just have had a very, of course, it's understandable adverse response to 2020. Because people felt like 2020, especially our young people who were graduating or who did graduate, and those who lost loved ones, really felt like 2020 robbed them. And that in itself. And no, you may not have been through war, but it can feel like that grief response or that loss is so distressing to you that it causes other these emotional responses that come up. So avoidance of a reminder of this distressing event, including memories. Can anybody say anything about COVID? You may get irritable. Someone mentions the name. You may get irritable, and you can relate this to not just the coronavirus or COVID from 2020, but anything that may be going on. So it's important that we understand if it's trauma, because a lot of times what people would do when it comes to these symptoms or responses is that we try to shut them down. And that's another way we talk about avoiding something. And that's one of the huge symptoms, or I don't want to say huge, but that's one of the main symptoms that people don't recognize that can be trauma, because it may fall up under the umbrella of anxiety. Oh, she has social anxiety. She doesn't want to go out and talk to anybody. Well, is that based out of from a distressing event that really caused a shift and a change in their thinking and in their emotions, or is something else happening? And so it's really important that we recognize that. And a lot of times people don't realize that a lot of the disorders or mental or social concerns or issues are based in a traumatic event or from a traumatic event. People may have a fear of abandonment, right? Because somebody has abandoned them in their life, which definitely would relate to it being a traumatic experience for them. And so they avoid getting close to people, avoid those relationships, avoid opening up, connecting with people, avoid anything that looks like a close relationship, because then they're really avoiding the possibility of being abandoned again. And so sometimes they make just like, you got commitment issues, when it's really based in a traumatic experience for this person. And they may not recognize it. They may just say, so and so hurt me, and so I don't deal with so and so no more. And we are in a world right now of social media where people are like, I'm just going to cut people off. I'm just gonna, and some people, what we call, what's the word I'm looking for? Ghost people or curve them or leave them on red, could be happening depending if there is a fear of commitment. I thought things were going really great, Theresa. We thought that was going wonderful. Was really connecting with this person. Then all of a sudden, they disappeared, didn't talk to me. I tried to text someone, I couldn't get a response, or try to call them, they didn't answer. And I don't know what happened. And so sometimes what that can be based in a fear of abandonment, if that's something that hasn't happened in that person's life. And so these are ways that they can come up and really bother what's happening in someone's life, or really disrupt the function. So what we call a pervasive problem is something that's disrupting the function, the everyday of that person. And so the everyday of that person may be, okay, my everyday, I get up, get in the shower, brush my teeth, put my clothes on, eat breakfast, maybe drink a cup of coffee or whatever my routine may include. And then I get in the car and I go to work. That has been my routine every morning, right? So say that's your routine. But then this event took place, and now my routine is no longer my routine. Instead of getting up, getting in the shower, putting clothes on, now I get up, I get in the shower, and maybe I, have this irritation that shows up when I get in the shower, or when I'm trying to put clothes on, I have this distressing feeling of what this irritability, this anger. And so sometimes we're not always connecting that we're angry based off of an experience that was very distressing for us. Now, I'm not saying that, because again, everything is not trauma. But what I do as a professional is that I'm someone that works back to the root, or work back to the experiences that bring up these feelings, these thoughts. And so for me as a trauma professional, Yes, we deal with what's happening right now. We deal with the irritability, we deal with the anger and the startle response or the avoidance, if that's what's happening. But after we deal with what we call the surface, this is nice. That this is what everybody sees, because everybody sees the irritability, right? People are seeing that you're irritable. People can see that you're angry or snappy or that physically avoiding startle response. People can see that, or they can or exaggerated startle response, or they can see the avoidance, but they can't see what's going on internally in the emotions, in the heart, and in the thoughts. And so it's important that we recognize where those responses are coming from. And so it does take work sometimes to back up and really look at that, like, oh, that was, I had an issue with, I got in a car accident and that really changed my thoughts about driving. Now I don't want to get in the car. Every time I think about getting in the car, I have a flash of this experience. And when we talked last year, so for those who have been following me or been coming into the lives every month or every week, last, I believe it was May 2020, and we did we would talk about common reactions to trauma. One of those was the flashbacks. And flashbacks is what typically people relate to. This is trauma. If I don't have a flashback, then I ain't got no trauma. If I'm not like having a startle response, like somebody who just came for more, then it must not be trauma. Or yet, there may be more of an undertone that's been such a problem or pattern, and what we would call a maladaptive pattern, which means this pattern has been going on in your life and it's causing problems in relationships, in your personal relationship with yourself or with others. When it's become that kind of pattern, even if it's not like, oh, outwardly and super intense, then it could still be this undercurrent that there is this traumatic event that has taken place. And so last year, there's a lot of people who are experiencing intense, or what we call compound grief, because they lost several people, or the grief that they have, or complicated grief. The experience that they have had with loss has been so compounded, because in the beginning, you lost somebody and then some people couldn't go to the funeral or the viewing and homegoing because of the restrictions of coronavirus. People, wasn't able to do a proper burial for family members. So not only did you lose someone, but you lost the ability to say bye in the way that you are traditionally ready to say bye. And so that can bring up these intense or powerful emotional response, because that event was so distressing. Not only did I lose my loved one, but I lost the ability to say goodbye. I lost the ability to be able to bury them properly. I lost the ability to be able to speak to in front of my family or in front of their family to say what they really meant to me. And because grief is such a tradition, or the tradition generally in the Western culture, is that once we have had a funeral or a homegoing, that afterward, family gets together to eat. That was not happening during 2020, right? A lot of people was not having repasses, is what we call them. They were not having a repass. So that's very hard when you're already dealing with the loss, and then you can't connect with people that you're usually connected with during this very distressing time. And so that can compound these emotions. And so a lot of people have been struggling with anxiety. And when we say the anxiety, the worry that the coronavirus is going to spread again. And so they avoid any potential or anything that looks like it could be related to the coronavirus. I don't go out anymore. I don't go to stores. I have everything delivered to me, or I don't have everything delivered to me. I keep everything in house. So again, we talk about avoiding any reminders that this can show back up in my life, any reminders that I can feel this emotion again, this distressing feeling, whether it was hurt, sadness, fear, whatever that was. I don't want to feel that again. And so I'm going to do any and everything I can to avoid it. I don't want to deal with it. And so that may come up with anxiety. People are like, well, she don't go out. She'll talk to nobody. It depends on where that is based. So when we say, is it trauma? It might be if your experience brought a powerful emotional response that is pervasive, which means it's continual and it's causing problems in your everyday re- re- everyday ADLs or your used to be pattern. If it's disrupted that, then it could be trauma. And so if you got to the question, you say, okay, well, yes, that I did experience that. It was very stressful for me last year. I was very worried, lost a lot of family members. I felt very alone. You know, all these things that emotionally, people have felt. We and COVID from 2020 was very compound anyway, because not only was it this pandemic that literally shut down people's worlds, all of our worlds, right? One day we may have been fine, and a couple of weeks later it was like, and nobody can come out. Nobody interact with anybody. We're going to lock you in or have you stay locked in to this place, whether it was your home, and wherever you were was where you were. So what if you were not at home? What if you were, again, people were at school. A lot of people were at their dorm rooms, and people were having a hard time and had to hurry up and get back home because this experience or this situation had taken place. And it disrupted that flow of what was happening in their everyday life, going to class, going to work. And so it causes a lot of distress. And people have just been like, just get it over. I just want it to be done. Just want it to be over and done with. Because we no longer, as a people, want to feel that anymore. And so that can show up in other areas. Now, I'm just using COVID as an example, but it can show up in other areas or may have already been present. We're avoiding the reminder of that situation, of that hurt, of that pain, whether it's avoiding that person, avoiding the places, avoiding the things. I'm going to avoid anything that can bring up that emotion for me that I do not want. And that can become, and I won't say a game, but it can become a mental game, and not game as in fun and play, but like your brain is doing all it can to tell you, like, avoid that, shut that out. And so all these uncomfortable feelings, you are like, I don't want to talk to them. They bring up this feeling for me, and so I'm going to cut them off. I talk to them, or they bring up this concern for me. Or I'm worried about this, so I'm going to cut that person off, or I'm going to cut this encounter off, this activity. I'm no longer going to go here or go there. When I maybe really enjoyed that activity or enjoyed that social encounter, I'm not going to do that anymore because this has had such an effect on me that it's, including trauma, it shifts your life. A pandemic has shifted all of our lives, right? So that definitely can be the case. And I know trauma is such a huge. Okay, now I'm starting to see questions, and I don't know why I wasn't seeing your questions before, you guys. I'm so sorry. Um, so Norman, can childhood trauma cause abuse? Yes, it can. So with regards to childhood trauma, someone who may have been abused themselves, again, that pattern, when we talk about abuse, especially for a child, it's a learned behavior. So for example, if every day I came home, I got punched by a parent or punched by a family member, got punched every day because they were angry. In my mind, or in that child's mind, that behavior is equated with anger. I see anger happens, I get punched. Anger happens, I get punched. So then when they grow up, that pattern can show back up either for themselves where they get angry and they punch, or for someone else for them, that they are around people or have relationships with people. So when they get angry, they expect to be punched because that's the behavior that they learned. So their brain has said to them, this is our environment. This is what we've learned. And we've taught our brain that this is what is a normal behavior until we teach our brain something different. It's going to continue to believe that. So to answer that, yes, it can cause abuse, but it doesn't always cause abuse. And sometimes it can cause abuse for that person on themselves. Some people get angry and they abuse themselves because they have been abused as a child. And so they just say that I deserve this because this is what happens or what happened before when I got angry. but it doesn't always mean that that's going to be the reaction or the outcome. Can abused cause abuse? So Norman, are you asking? I think you're asking the same. Can abused cause abusers? So hope I answered that question for you. If I didn't, please clarify what you mean. Can abused cause abusers? Trauma can disrupt the daily regimen. What lifts trauma that allows us to go back to normal? Retraining the brain, which takes work. And so generally, if the symptom is or the present, I don't want to call it symptom. If the presentation of what's happening is I'm avoiding this reminder, I don't want to deal with it, I don't want to have, that feeling again, then the reworking of the brain is to expose you slowly to what you've been avoiding in a safe manner. Let me give an example. So as a drama therapist, if you have been, say somebody's afraid of snakes. I don't like snakes, y'all. So to speak, just throw that out there. But it's different to not like a snake and then to be traumatized by it. So if there's somebody who's like had a traumatizing experience with snakes and they don't like, that's just something that they are just traumatized by. Then we start slowly exposing them to it, where we start having them talk about snakes. So that's one level of exposure. Then we may bring a picture of a cartoon snake, a picture of a real snake. Take them, to a zoo where the snake is behind the cage, but they're standing there. So each level of exposure lifts, but the whole time they have a safe person or safety around them so that we can monitor their reaction to it. And also while we're working on retraining the brain and giving the brain new information, that this is okay, that they're not going to be hurt as they were before. Or even if they are worried about that they have a new set of skills now because they're no longer that 5-year-old, 6-year-old, or whatever age they were before. This is a different person that we are working with in 2021. Sophie, that answered that question. Is there ever a normal after trauma? I guess it depends on what you mean by normal. There is life and healing after trauma. If I didn't believe that, I would not do the work that I do. I'm not saying that it's going to be easy to get there. So going back to like what Norman, where you were asking before, is that when someone has had years of trauma and they have, in the earlier that they have had that, the more difficult that it may be to untrain the brain to that behavior, or to feel like that behavior is actually appropriate or adequate. With regards to that, it's going to take time, but it also takes a trained professional to make sure that they know what they're doing when we are talking about trauma, because we don't want to cause more harm and what people call re-traumatizing, but we don't want to cause more harm with any technique that we do. So if you're not trained in working with trauma, then please do not. If you're looking for a trauma specialist, please make sure that the person has experience in trauma. Ask those questions. Have you worked with this type of experience? This is the experience that I'm trying to get help with. Or my loved one is trying to get help with. Do you have experience? You ever worked with somebody that's been in war? Is your trauma experience with somebody who's been abused as a child? Those are questions that need to be asked before you start engaging in that professional relationship with somebody. If you're going to therapy or counseling or seeing a psychiatrist or psychologist or your medical doctor, please ask that doctor, whoever that professional may be, if they have experience there. Hurt people do hurt people, unfortunately. And the reason for that is, again, because we don't have any new information. And I'm not excusing anyone's behavior, but sometimes when we are asking that question, well, why do they keep doing that? Like, it clearly, like, you can't see this is causing problems. I will be honest, when it comes to trauma, sometimes what leaves is memory. When it comes to trauma, people talk about amnesia, the more is the far the spectrum of memory loss. Dementia is also been found to be based in trauma from years past. So memory is really affected when it comes to trauma. And it's because the brain has already had to work to keep you safe in that experience. And then if it doesn't get the healing that it needs, it will continue to overwork itself and tell you that everything is dangerous or this is dangerous. So it will keep on having you reacting as if this experience is still happening over and over again. So as I mentioned about the child who's been abused and saw anger and got punched. So it's going to say every time somebody gets angry, you may jump and flinch thinking, I'm going to get punched. Like you may be like, no, I'm just mad about this stupid, test I got to take. I'm not, why are you jumping, Theresa? What's wrong? Well, if that's been my experience, I don't understand why you wouldn't hit me if you're angry. But when that starts to become the new pattern, they're like, okay, maybe Theresa's not going to hit me. Right? And that can cause, people don't even understand it. Sometimes that can cause distress. And I don't understand how to sit with the feelings. And that's a whole different life for a different day. But I just will say that sometimes the trauma response can be that the person creates chaos unconsciously because they're used to chaos or they're used to pain. And I won't say, I call it chaos, but the chaos of abuse or the mistreatment that would have happened in earlier years in their life. If that has been a pattern in their life, they're used to that, then they may unconsciously create that. And that, again, hurt people. And those hurt people also hurt themselves, whether it's mentally, emotionally, or physically. Okay, so I did answer your question. Great. A personality disorders caused from trauma. Let me first say, I don't specialize in personality disorders, but I have had a lot of experience with personality disorders. In my professional experience, because my experience started in a prison. So that's where I got the love to work with people with trauma. And everyone that had a personality disorder, the answer was yes. They had a very traumatic experience, and especially in childhood, that altered their personality. So when you hear people say like, oh, that's just Theresa. Why is she always irritated? That's just her. Well, she wasn't born irritated, right? Like people just wasn't, there's experiences, even if they were born, something happened in the womb, because their trauma can actually go all the way back to in vitro, where things happen in the womb. Trauma, birth is a trauma, right? It just is. It's trauma for the baby and for the mother and for the father as well, can be. So there can be things that are happening that you're not consciously aware of, which is why it's important to have somebody who understands trauma, because they've been trained in how the brain works. And because the brain is what is giving our body the instruction. So the brain is saying, snakes are not safe. Don't go around anybody who doesn't have a mask on with COVID. Like people, the brain is telling you what's unsafe, even if it's no longer unsafe. Even if this toy snake sitting next to you, logically it's a toy, but because it's a snake, your brain is saying snake, danger. Snake equals danger. Anger equals danger, right? And that's not always the case. And so we have to retrain the brain and give it some new information on a persistent and I guess I'll just say persistent because the other word is not coming to me right now, but I'll say calculated, but persistent and consistent method to make sure that we are actually retraining. And as we retrain, we're also checking in and being sure that the person is safe. And so we're constantly tweaking and make sure the treatment plan and the treatment that we're giving is matching the person. So no trauma treatment should ever be a blanket treatment, because each person's experience is unique to them. And so when it comes to trauma, so again, to answer that question, when it comes to trauma, it really comes to your personal perception. And I know we have lived in a world where emotions have been invalidated, experiences have been invalidated, especially, again, if you've come from a history of abuse. No, that's just, you just need to keep working hard, or and your feelings, you don't even trust them anymore because someone else has invalidated them so often that you now invalidate them. So again, it creates this pattern that you keep doing what's bringing pain. So that can be very, very stressful, right? And so when people begin to realize, like, my life can actually be better, I don't have to keep living this way. And when we start to really work on the the roots of depression, anxiety, ADHD, in some cases, personality disorders, we find our way. There was this distressing event that has altered the way the brain, and literally trauma does alter the brain. So nobody's just making up their responses. The brain is actually altered by this experience. So people coming back from war is not just like, oh, we're just making it up. We have a lot of empathy and understanding for people who are coming back from war. But when it comes to trauma, if it's that distressing, your brain has said danger comes sometimes can mean that I'm going to die, or this is so unsafe that the brain's focus is to keep you safe, or the MO of the brain is to keep you safe. And so sometimes it would create these very stressful things to keep you safe, or so that you don't keep on experiencing that feeling. So that can be frustrating. So I know that we said it was going to just kind of be a few minutes. Trauma is such a big one, but this whole month we're going to be talking about trauma because this is PTSD Awareness Month. So we will pick back up next week and kind of go a little bit more deeper when we talk about trauma and PTSD. So we will talk. That's just trauma itself. We will talk about more in detail PTSD next week. So feel free to join me back here at 8 o'clock Eastern Standard Time. I think that's 10 Central Time, and I think it's 8 Mountain and 7 Pacific PM. Feel free to ask your questions if you're watching this live afterward. When it comes to trauma therapy, I did say I was going to answer that question. Body-based is one of the best ways to reach the healing of trauma or the other side of trauma, because trauma lives in the body. And so in order to heal from trauma, we have to access the body because the body has the information. And sometimes it's hard to get that out for just sitting on the couch or just talking only. So with drama therapy, we use body-based techniques. We move movement. We use art, music to be able to access those untapped places in the brain, and also to be able to create safety for the brain again, so that the brain will actually open up and allow us to go there. But it's a whole process, so we won't go there tonight. So thank you so much, you guys, for your questions. Thank you so much for joining tonight. Feel free again to ask questions if you need to. If you don't feel comfortable asking on the live, feel free to go to our page and ask and send me a personal message. See you next Monday, 8 p.m., same place, same time. Have a great week, you all. Bye-bye.